Yes, I'm Judith Kramer. I'm the secretary of the SHA. Unfortunately, not only am I on Zoom, I'm on my phone, and it's proving really difficult not being able to log on my laptop. So I have to thank our chair, Mark Ladbroke, who should have been giving this talk. So the SHA is delighted to share the platform today with workers from SNEFT fighting outsourcing and privatisation. For those who aren't aware, we were formed as the Socialist Medical Association in 1930. The name change came in 1980. And from fighting for the creation of the NHS to defending it as a publicly owned, publicly delivered service, free at the point of use today. We fully support those standing on picket lines. The Telegraph has called for us to be thrown out of Labour for this sin. And we fully back mass demonstrations. We also stand with colleagues in the trade union movement and socialist MPs such as Richard Bergen, who are also taking the battle into the heart of the Labour government. At Labour National Conference, by tabling motions, we've consistently won huge majorities for our positions in favour of public services, which were backed by our colleagues in affiliated unions. We even got a massive majority for the proposition that ministers should not take funding for corporate interests. We helped win a promise for the biggest wave of insourcing from a Labour government. Then suddenly, just before the general election in July, our motions were blocked from being debated at conference in September. But why is this political view important? Why are we blocked? Perhaps because so much profit is made around the world from providing a health service. And the struggle against outsourcing is so important because it is the terrible vision of what is to come for the NHS workers unless this drive to the market is stopped. And for the public, for patients, does it matter? Yes, because every penny diverted into the pockets of big business comes out of our healthcare budget. And just as an example, the Mirror reported on the 9th of November that botched treatments and surgeries outsourced to the private sector has led to the NHS paying £83.6 million to patients in the last 5 years. Including legal fees, this brings the figure closer to 175 million. And this involved 1,063 cases. This takes no account of how much it costs the NHS to rectify these botched surgeries, because of course, when things go wrong in the private sector, the patients always end up back with the NHS, who have the expertise. Labour's first budget just weeks ago promised increased funding for the first 2 years of Parliament. All well and good, but then what? NHS cash has been delivered, but at the same time, social care is being strangled. It is inevitable and probably correct that much of it will be diverted out of health and into care. Public health, again, is largely based in local government and which aims to promote healthy living. This will also, quite rightly, need to be funded. And it is inevitable and again correct that much NHS funding will go this way. You simply can't feed one part of our health and social care service and starve the other part. Social care has, of course, been broken up and privatised years ago. It is a disaster. Patients and clients suffer appalling neglect. The workforce is severely exploited. It too is a hellish vision of the future for our NHS. Never has unity been more important in fighting those who would strip the NHS of its services, its provision of healthcare, and reduce it to a mere dealership system. We are proud to stand shoulder to shoulder with all those fighting to defend Bevanite principles, and particularly if you're in the Labour Party, do come and talk to us at our table. This Labour government must deliver on its promises, because providing a healthcare system that works for all is fundamentally a human right. Thank you.